kind of in a minute share a little bit of the response you got from the hospital when the events occurred.
Well, I think I mentioned earlier today the response was great. Dr. Torlani and I really developed a bond, and I walked out of that that whole situation. I don't know if you're familiar with the term collateral beauty. Sort of like in everything bad, something good comes of it. And for me, I was in a service field for 37 years. The accident happened, and I'm now in a service field again. And that's the collateral beauty of what happened to me, and the way everybody treated me, especially my bumblebees.
The doctor spoke with me, the nurses took care of us. Also, a lot of administrators came to visit Jack and speak with him and with me to reassure us about, Jack was worried about bills, mortgage, things like that. So they came to reassure us about that. They let us know what happened, when it happened. The doctor actually called me at home. If I missed rounds, he would call me and let me know if he saw anything different. He was the one who called to tell me about what happened with the device. He made suggestions for Jack's care. He didn't have privileges at this hospital, even though it was part of the system. He didn't have privileges at this specific hospital, but he would make suggestions for his care over time. And those were the main things that were going on with people in the quick, early stages. And it seemed like anybody who was on that floor that worked there, that whether they were a social worker, a discharge planner, a nurse, a doctor, a physical therapist, an occupational therapist, an aide, a housekeeper, whoever, everyone always came in and was very concerned about myself and the patient and asked specific questions, gave us certain information. So it was a very caring environment, and I felt like they really had the whole thing going for them. They really had, from the administration on down, they knew what they were doing.
So our experience was a little mixed, in that, so in the hospital when Lewis had died, nobody knew what had happened. They were baffled. They thought he was fine, and suddenly he coded. So they really pressed for an autopsy, and I said no. I mean, they had been torturing my son as far as I was concerned, and I wasn't going to let them keep doing it after he was dead. And they tried to get the coroner involved, and the coroner said, I don't have jurisdiction. And finally, my husband gave permission. My brother said, if you don't have an autopsy, you'll never know what happened. And Barr agreed with that. And so we did an autopsy. And Lewis's surgeon, who had been at another hospital that day, wasn't in the hospital. And he called us as soon as he found out, which was pretty late in the day. And he said, I'll go to the autopsy for you. And I was just horrified. And I said, well, please don't let them touch his head. And he agreed to that. And he called us right after the autopsy. And he told us what it was, that it was a perforated ulcer. And they did not touch Lewis's head, which I'm sure would not have happened if he had not been there to speak for us.
So when we lost Alyssa, there's a couple things I will share. No one knew what happened. We walked back up to her room and had to pack up her stuff. No one helped us. We walked out to her car and we left a hospital without our daughter. No one telling us anything. The second year resident we were working with walked out and quit. Some months later, she was allowed to come back to the program. And later, if you want to talk, I can give you more details about that. 2 days later, we go to make funeral arrangements, and we're at the funeral home. No, we call the funeral home because we're asking them what we need to bring. And they tell us they don't have a body. They don't have our daughter. We're like, what do you mean you don't have our daughter? And they said the coroner wouldn't release her. And we're like, what do you mean? We didn't order an autopsy. So I called down to the hospital because I'm like, what is going on? Someone forged our signature to do an autopsy. So when I finally get through to her physician and I'm calling the hospital, she's in the middle of having an autopsy that originally was supposed to go to an outside coroner, not be done at the hospital. And they begged us to let them do it, and we let them continue. What are you going to do? You're in the middle of an autopsy of her daughter. In hindsight, am I happy? Yeah, because we found some stuff out. But unlike Helen, my rights were violated again. My daughter's rights were violated again because we did not sign that to have an autopsy. 3 years, 7 months, and 28 days is how long I had to wait to have the first honest conversation with the hospital. I still don't know what happened because the two main people will never talk to me.
Listen to the patient, listen to the patient's family, doctors, listen to the nurses. I always have when I address nurses, I always say, listen to the doctors, but do what the nurses tell you to do. Because they're with you all the time, but once again, listen. And you'll be a great caregiver. You know, get down, sit down, squat down, whatever it takes, but you know, bring yourself down to the level of the patient and then maybe ask a question and sit back and listen.
You know, I think listen really does sort of sum up a lot of things. One of the things that I think about is that you need to always be conscious of the disequilibrium of power, even if you don't feel it. People are vulnerable to you. And what you do and what you say matters.
Just compassion, benevolence. Treat us humanely. Treat us like we're your spouse, your child, your sister, your brother, your mother.
I think it looks like a conversation rather than one person imparting information and the other person receiving it. Because there's an article that I love that was in the BMJ a few years ago. It's called something like What Happens When the Patient Knows More Than the Doctor. And it's about how, sort of like what happens when the nurse knows more than the doctor, how the strategies that patients have to employ to sort of get what they need, like the expert diabetic who has a doctor who doesn't really understand type 1 diabetes, what they have to do to sort of get the new doctor on board without offending them. And it's not easy. So I think people have to be open to that, to the idea that they may not be the expert in the room on everything. And just approach it in that way. You know, what can I do for you? The concept of servant leadership, I think, is really important in all of these areas. People don't necessarily know what to ask for. I think that's another issue. Just as, in Lewis's case, we discovered the literature on the procedure that he had after he died. We didn't know it was there. We would have read every article if we had. Very cautiously.
I went to the doctor and there were some procedures they wanted to do, and I said, because of what happened to Jack, I could not go under anesthesia, period.
I don't know. I don't think I'd have a big problem with it. I have been back to the hospital in the last 2 years several times and admitted for different issues, so I've kind of gotten used to it. I feel I have a different perspective now. I'm a little more aware of what they ask and what the expectations are. I've had basically 2 medical errors occur on 2 of my stays. One with a resident who listed one of my medications, and because I'm on so many different medications.
Mine was more emotional, and who suffered was my son. Because I could not go back to the pediatrician's office. I emotionally could not walk through that door because it had so many emotions. So for several years, I didn't take him in for physicals. And when I finally could, I regret that I didn't. Because my pediatrician, 6'2", huge man, broke into tears. He was at the funeral, I remember seeing him. But he broke into tears because he thought he let me down. And he didn't. And Alyssa was the first child in his career he had lost. So here he was suffering because he felt bad. So there's a whole aftermath that most people don't even understand. It's the fear, but it's the emotional toll that takes a lot too.
We took it in. Were we interested in that moment in saying, tell us what happened? No. But if someone had said to us, tell us what happened, we certainly would have. We were, because it was going over and over in our minds. I mean, there's a movie that plays in your mind, and it doesn't stop for about a year. And it's the movie of those last moments, and it's nonstop, repeat play. So you don't think about anything else for a very long time. So yeah, we wanted answers.
The doctor called me from the OR. So I am a nurse, but still, how am I supposed to be making any decisions at this point in time? But I had to pull it together and give him an answer. When the doctor came out and drew the pictures and started talking to me, as you said, the family gets, yes, I did. My friends took in the rest of the information. But the doctor came back and he kept explaining as we asked and gave us information over time, the same information, time and time again. I know the first day when Jack was admitted to the ICU, they hadn't had patients there who had had a spinal cord injury. So they handed him a call light. And I'm going, oh, he can't move. We have to do something else. So for me, I kind of had to go into nurse mode. Thank God I was a nurse, because I don't know how people do it who don't. But so those were pieces that we did. But I think it did take a while to sink in. We didn't go home for 3 months from the first hospitalization. And I went home thinking, I had it covered. I had planned everything in my head. People had been to the house to measure, adapt. And still, when we went home, things weren't ready to go. Things didn't go as we thought they would. And we had to work at it more and more and more. And there's still things we're learning.
I am in a totally 100% different situation than these young ladies. I can't even imagine in my wildest dreams what it would be like to lose a loved one. So I don't have anything to compare with them. For me, waking up in the ICU, it wasn't really a big deal. And I don't say that callously. The call light was funny. They took care of it by giving me a big paddle right by my chin that I could move my chin to. The first night or two was a little apprehensive being in the ICU and not being able to move, but I got over that. Told myself I was being a baby about it, but what I counted on, and the reason I didn't have to worry about it, is because I had Teresa, I had my kids, I have 4 sisters, and 5 brothers, of 2 that I like. I have, without a doubt, my extended family is unfreaking believable.
I was not angry. I mean, I didn't believe that anybody wanted to hurt my son. What makes people angry, and it makes me angry at the residents sometimes because they have never sought me out, and they did not respond to my overtures. But when people are treated the way Carol was, treated as though the life of your child doesn't matter, that's when you get angry, and that's when you get, people who commit violence.
My anger was internal. It's because I still carry all the guilt. Not only was I the one there, I had to let her go. So they had to come to me and say, you have to let your own daughter go. Maybe someday I'll really feel anger when I have answers. What I feel is guilt and shame and responsibility. So again, when we go back to that, it's not always anger. We have so many other emotions. In some ways, I'd like to feel anger. Maybe then I would have answers. So I don't know if that helps you, but every one you would talk to is going to tell you something differently.
No.
No, Jack was never angry. That's what we talked about before. He only had so much energy. In the beginning, I wasn't really angry. I don't know that I could label it. It's shock, it's disbelief, it's surprise, it's kind of like, yes, she said horror. And you're trying to sort of push it away. So you push it, I think, onto another person, sort of onto the doctor. Our doctor, when I talked to him, was so gracious. It was very difficult because I was talking to him out in the hall and telling him how I felt. And he said, I can accept that. And then I'm like, what? That's like the wrong answer. You're not supposed to be so gracious to me. We were never angry or yelling at each other, but that was something that just floored me when he said something like that. And in my head, I'm thinking, what? Where did that come from? I can't believe it, that somebody would be that gracious and accept that, knowing how much pain he was in from dealing with Jack's situation.
I think it should be an enhancement. The problem is if you're using learners as cheap labor, it's a danger for everybody. I think at some point, healthcare providers have got to take this in hand, and our teaching system is often a big risk to patients. It certainly was in our case, and one of the ironies I think in our case was that my husband and I went to Duke, and we had both worked in Duke Hospital as undergraduates, and we'd heard about the Libby Zion case. We sort of, we'd seen what it was like in the early days, and we thought that had all been solved. And so we hadn't been in a teaching hospital since. And when we went in, we realized that things had not changed, and that was a big surprise. We weren't prepared for it. We thought we knew a lot more than we knew, basically. We thought we understood the system, but we were trapped in the system because of the hierarchy. If we'd been in our community hospital, we could have called our pediatrician, and this wouldn't have happened. So I think the learners can be a huge benefit because they can be an addition, but at some point you all have to say, we're not going to be used. We're here to learn, and we're here to help. We're not here to perpetrate a system that doesn't help anybody.
So Josh, I have a whole nother life, and I've worked with medical students, residents, fellows in another career I have. But they were my care team, and we were, I thought, a well-oiled team. The resident, as I said, walked out and quit, but she was set up for failure. So she had been on a NICU rotation the month before and lost 2 children. Nothing to do with her. We know NICU has sick babies. She was emotionally a mess, and I found this out months later, and they were concerned, and she probably should have been pulled off. She was not in the right frame of mind. And the night that things went wrong with Alyssa, it was a full floor. So, it's knowing your own limitations too, or as we say, when, you've got to have your own colleagues back to say, you know what, they can't do this. Now, has the organization changed? Now we have hospitalists, but the hierarchy was still there of not going up the food chain. The fellow who worked with us, she got reprimanded. So she was down with us in the PICU when things went south, and a social worker came down, and there was a feud as to who was to be there, and I looked at the fellow as our person. She was who Alyssa wanted, she was who we wanted. There was a turf war. It went up to her chair, her director, and she got something put in her record that she was too close to patients and families. We were only in that hospital for 8 days. It's not like we were there a year as an oncology patient. We formed a bond, but that is not right. She was our patient, our choice, and I was glad she shed a tear. But she was not allowed to contact me. I couldn't figure out why I had never heard from her, why she wasn't at the funeral. And when I finally reached out and I said, will you meet with me? She's like, yeah, but we have to go where no one might see us. She was told she was not to reach out and talk to us. So you become part of our family, and especially if it's pediatrics, it can be a lot of things. You are part of our team. We want you there. So, listening to this, I don't hold anything against, I call her a resident. She's not. She's a full practicing physician now. I hold nothing against her. I feel bad that she wasn't taken care of. She was set up for failure, and the system afterwards did not take care of her. We need to take care of you all as well.
I observed very little meaningful interaction between anybody, to be frank. I felt that people were just sort of cogs spinning independently. You know, when I was in the hospital, I didn't know who was in charge, and I didn't know who to go to. And that was one of the big issues. We just did not know who to call. So when I got Lewis's records, I tore into them. I wanted to know what the plan was and who was in charge. And I was just baffled, but it gradually dawned on me that really no one was in charge. And there really wasn't a plan. It was just supposed to sort of happen. And then there was this diffuse responsibility. So there was really, while theoretically there was maybe an attending physician in charge or an attending physician in call on charge, but they weren't anywhere in the records. They weren't part of it. So there was really no one for us to go to. Because when we asked for the attending physician, that's not who came. And that's an unusual thing, I think, for the attending physician to come. But so in terms of the residency system, I think that's the big issue is that there is a lack of accountability. There's no one, the buck doesn't stop anywhere.
Mine was the hierarchy. It's huge. The resident was afraid to go up the chain of command. And then when she did, and the fellow said, "I'm not coming in, don't need to," she was overwhelmed. So hierarchy plays a huge, huge issue.
I thought for the most part the staffs communicated well. We do sometimes have to just roll the dice a little bit, and hopefully if something happens with somebody above you, will back you, have your back. And then since the mic's in my hand, the question over here. Dr. Torlani had told me afterwards that, we sit down, we talk about a lot of different things. And in the operating room, he has his huddle, and he doesn't have a huddle unless every single person in the operating room is going to be there. And he tells them we're all equals here. If you see something, you say something. And it doesn't matter where you think you are on the totem pole or in the pecking order. Everybody is equal. And
Okay, we're at the end of our time, and first thank you to our wonderful panelists. We thought this would be a special way for you to connect and understand and learn a little bit more, and you guys were great and really helped there. You think about these secondary benefits of being open and honest and doing the right thing and having these conversations. You can't make this stuff up, and the importance of the secondary benefits are just sometimes as powerful as the first potential benefits and stuff.